We have two topics to discuss today with Dr. Syed Hussain from Trinity Health in New England. Good to see you again, Doctor.
Likewise, Tim.
The first one you've already told me you're very, very concerned about, and I want to make sure we're portraying these numbers correctly. We're talking about antimicrobial resistance, essentially superbugs that you can't get rid of with antimicrobial agents. Now, since 1990, the estimates are that about 36 million people across the world have died from 1990 to now, but that number's expected to grow between now and the year 2050 up to 39 million people who have been directly killed from that. That would be about a 50% increase. But doctor, you're telling me that's just directly associated deaths.
Absolutely. So this study, it's a landmark study that got published in a very reputable journal, Tim, and it estimates between now and 2050, so next 25 years, we'll see 39 million deaths directly attributable to this superbug phenomenon. I'll explain to viewers what that means.
Right.
But 169 million deaths with association from this.
Yeah.
So what is this that we're talking about? So basically, this is when bugs, pathogens such as bacteria or fungi, are able to evade the medications that are intended to kill them.
Yes.
Basically. So there's a lot of factors that go into this, but this study is a wake-up call. That now there has been discussion and work going on in the healthcare arena, but we need all hands on deck to ensure that we are able to bend the curve.
Yeah.
And by that I mean, ensuring that in some regions and countries of the world, whether it's sub-Saharan Africa, South Asia, Latin America, we still don't have equitable access to quality care, which plays a role into this. But also on the flip side, in the more developed world, making sure there's antibiotic stewardship. There's a lot of misuse and overuse of antibiotics. Which
what about
basically
like soaps, like antibacterial soaps? Should we be doing that?
It all goes into hygiene, so yes. But in terms of the antibiotic stewardship, that's an important component. Plus, we need to dedicate more resources towards newer antibiotics that are able to fight these superbugs.
Yeah. It's a cat and mouse game. I mean, and again, we said superbug on that graphic. It's not just one bug. I don't know if that makes it better or worse.
That's right.
Yeah, we're just talking about these viruses and pathogens that will evolve defenses against what we already have. So that's just part of that game that's going to have to go on. Moving on, I want to talk about an interesting association between menopause and possibly some dental effects in women undergoing menopause. What's up with that?
Yeah, this basically is related to estrogen. Long story short. So estrogen levels decline as women enter menopause, which is basically 12 months or more of no period. Yeah. And estrogen is really important, Tim, for gum health, for saliva production, for bone density. So all of these tend to take a knock with lower levels of estrogen.
Yep.
So what women need to do is make sure they have, they're sticking to a good oral hygiene program, a good diet with calcium, fluoride toothpaste to strengthen that enamel around the teeth. And then most importantly, and I refer to this all the time, is an appointment with your dentist at least twice a year to ensure that there's no tooth decay or cavities that can be nipped in the bud before it gets to much larger dental problems.
Is there any association with perimenopause before menopause sort of has its full onset?
Good question. It may actually start before menopause actually sets in. So that's a few years. That period is a few years before menopause, which is late 40s for most women and early 50s. But again, going back to making sure that you're sticking to a good oral hygiene program and having at least an annual, if not twice a year, dental appointment.
In other words, things you should be doing your whole life. So there you go. All right, Dr. Hussain,
thank you.
A lot to get to. I think we'll be talking more about these potential superbugs in the coming days and weeks. A very alarming story and study there, Erica. But for now, we'll send it back over to you.